All right. Okay. So why I chose clinical psychology is because it's all part of you dealing with the assessment and the diagnosis and in the treatment plan of psychopathologies, right? You can work within a psychiatric institution, but you can also deal with within the private practice in what I'm doing more now, in the more assessment, but also treatment and psychotherapeutic work. In more generalized problems with the generalized public that's not necessarily institutionalized or inpatient. So the reason why most patients are admitted is because they're in a very critical time in their lives or in their diagnosis. So what happens with patients that get admitted into psychiatric institution, they're either a danger to themselves or a danger to others. So those are the two major reasons why they get admitted. Or they have lost so much touch with reality that they need to be stabilized and their behavior is too erratic that can cause some sort of harm or danger to themselves or to others, and therefore cannot function outside yet in normal social environment and need to first be stabilized in an institution before they can go out again and be seen maybe as an outpatient, and from there with the correct kind of treatment plan they can lead very normal lives going forward. Yeah. So, well, depending on their diagnosis, right, whether it's schizophrenia or some form of psychosis or a mood disturbance or substance, my role, once the chemical component of it from the psychiatrist is taken care of, then I am more in the psychotherapeutic field, right? And I'm also in the assessment and in assisting with the diagnosing. No. Well, it has to happen before, okay? And then we all come into agreement, right?
Okay.
The psychiatrist and the psychologist and all the other parties involved. And then we try and stabilize the patient. But then further assessment needs to be taken as well or done because you need to administer whether the patient is improving or regressing.
Sure.
All right. So then, and that will also help in how the treatment plan goes.
Okay.
And how it develops. So I'm part of that in the continued assessment and continued care of the patient as well.
Okay.
And then I see the patients in the individual psychotherapeutic work, but I also collect a lot of information regarding collateral information. So from family and friends or anyone that is close to the patient, just to find out what are the dynamics outside of the hospital.
Yeah.
Because there's no point in treating and stabilizing them and returning them back into an environment that might not be as healthy, or there are extreme external stresses that might exacerbate or perpetuate the disorder. So what I will do is we will do the initial assessment of the patient, and then that will lead to a formal diagnosis of the patient. Then thereafter, we need to see if the treatment is actually helping. So whatever was prescribed by the psychiatrist and the whole treatment plan for the patient, if there's any progress in the patient. So further tests are administered, right?
Okay.
We use a whole battery of tests depending on the suffering or the symptoms of the patient. Okay. And then those continued tests occur throughout the journey of the treatment, including the psychotherapy individually with the patient, but also psychotherapy with the family or people that are closely related to the patient.
Okay.
And also doing collateral on the whole environment of the patient. Well, in the sense that it's all interrelated and it's all very integrated. That's why we work in multidisciplinary teams, right? Where you never just work, where you rarely work just alone, right? You work with the patient's psychiatrist. And then in most institutions, there's a psychiatrist, there's an occupational therapist, and then there is the GP, general practitioner doctor, then other psychologists that are working with the patient as well. And then, even in some hospitals, there's a physiotherapist, all working together to assist the patient in their functioning. and also the nurses in the institution as well, because they watch the general everyday behavior of the patient, their functionality, their general functionality with others, and their interaction with others overall outside the assessment room. Well, that is a major question, but yes, personally, I do feel that I make a big difference in people's lives. Not to toot my own horn there, but I think most psychologists, we work off the premise of helping individuals understand their disorders and their diagnosis, right, to normalize certain emotions and certain moods or certain symptoms they might be experiencing, and to show them that, you know, when you put a name and a certain label to something, you're not just some stigma, you know. It shows that, it validates that, you know what, there is something that I'm actually suffering from. It's not something that I'm choosing to feel or I'm choosing to behave in this manner. There is research and evidence to show that I'm not the only one that behaves and reacts to things in this manner, or that feels this way, that there's a certain disorder, there's a certain like label, and an actual, it validates what the person experiences, you know, because some people will be called various derogatory names because of their behavior and because of the moods that they experience because of the disorder. So this, I feel like, for one part, that's what we assist with, but also in managing their disorder through the psychotherapeutic work, through the assessments and the evaluations that we do, through working with the family and all the external external stresses that they might be experiencing. We assist the patient or the individual to actually live a normal life and to be functional in society as well. So that helps with their competence, their sense of competence and sense of value to their lives. So with that question, there's a technical side to it, and then there's the other side to it where it goes towards the psychologist's discretion, right? The one side, the ethical side of it, each patient is allowed to know ethically what their diagnosis is, okay? So that's the ethical part of it. The other side of it, we want to give the diagnosis, or to let the person know of the diagnosis when we feel like it will be helpful to the patient, not something that might exacerbate a problem or harm the individual in any kind of way, or make them behave in ways that might be worse, you know. So there, it's usually the psychologist's discretion, and many psychologists use that to their own kind of discretion, and they make the decision for themselves. Will this help the patient? Is it in their best interest? How can I explain the diagnosis to the patient so that they properly understand? Like, for example, the narcissist personality, I mean, that label has been really, I mean, in social media, everyone uses that label in a very villainized manner. So it's almost turned into like an insult, you know. Someone wants to insult you, they say you're a narcissist. So there's a horrible kind of stigma related to narcissism. But when you really understand the whole diagnosis fully, and you comprehend the picture of what narcissism means, you know, it doesn't always have to be so villainized the way that it has in social media. So certain diagnosis has been kind of villainized in a way, or made a stigma of. So it really depends on the psychologist and what will be best for that individual unique patient. Well, I think it's mostly the work that I do, right? It's a very professional relationship that I have with the people, but it also has this other side of it, this artful side of it, where I become so intimately involved with the patient in their lives, you know, in assisting them, while still having this objective evidence-based stance in the relationship as well, and intricately working through the treatment plan with the client, while being just a facilitator while they're the driver, you know.
I hear you. Okay.
So it's so interesting. Besides that, also, the human mind is just so amazingly interesting as well. There's always things to learn, especially not just in the personality sphere, not only in the psychopathology, but even in the neuro psychology. We're always finding out new things on cognitive processing and cognitive functioning, and it's just so incredible. It's just so broad, and all the different ways in which to test and how to get even more intricate, and it's just really amazing. Psychology is just a continuing personal professional development. What I like least about being a clinical psychologist, I think it's because of how ethically you need to maintain certain boundaries. Okay, those are really, really important, right? And any good psychologist knows that you need to remain objective in your relationship and in treating the patient as well. But there are some patients, of course, that you feel, goodness, if there was just this one external factor that I could change. I've come across a couple of patients where there's certain external factors that perpetuate the problem, and there's certain boundary lines where I can't cross, and it's up to the patient to make those changes to their own environment. And it can be so difficult to actually just watch that, but that's all part of the process in watching the patient maneuver through their life and through the treatment journey. Well, patience is a big part of it, but also to make sure that you are objective enough and know when to step back, right?
Okay.
And to remain, because that line can be, it can be quite thin at times. So you need to maintain that objectivity and those boundaries while being able to elicit a sense of empathy,
Yeah.
So it is really quite important to have the patience, but also to have the objectivity as well. So with psychology, it's really a thing of, there's part science, right, and part art to it. Okay, so in the scientific part, it's all the things, the theory, the theoretical information the training that you get, right? The artful part of it is, like you said, that intuition that you kind of build up for yourself. We can all be taught how to respond empathically, but empathy develops over time, right? And to you as a person. So it's really one of those things that some parts are a little bit of art, a little bit of intuition, and that kind of play between the art side and the science side.
Yeah. Okay.
So the most challenging part of being the psychologist is that you're constantly a researcher, fundamentally, right?
As a clinical psychologist.
As a clinical psychologist, right? Because you're trying to research the patient, right? And a patient might come in a particular way, and then it's very difficult not to make those initial immediate inferences. You need to have the patients to do the clinical interview, but do all the other battery of tests as well, so that you can work more deductively with the patient, so that you make sure that you have a more comprehensive picture and that your picture is not very one-sided of what the patient is, right? Even if you might have that intuition of, oh, I think this is what's wrong with the patient, or I think this is what the diagnosis is, making sure that you have all the information and you make sure that you have a good comprehensive picture of the patient and not something one-sided, and to consistently work as deductively as possible.
Yeah, I can see how that could be challenging, sure.
Yeah. That's the other part, something that you have to learn, I think, early on. For me personally, I try not to, but again, it can be quite difficult. You get so intricately involved with the patient, and each case is so different, and some parts of patient suffering you might relate to, and it can at times be quite difficult not to take work home with you, right? But it's very important for me personally to have that sense of boundary as well, that it is still a professional relationship where therefore all professional work must remain at the workplace, and then I can continue with my own personal life as well, to have that division, so not to take work home. But it can be quite difficult, especially either you relate to the case or it's a case that you've never seen before, so it's quite interesting. So from a research base, it can be also quite interesting. So there's many layers to it, but I think it's an important division to maintain.
Yeah, I agree.
For the sake of you and for the patient as well, because you don't want to also project certain things. When we sometimes take work home, we get too intricately involved in it and we involve it into our personal lives as well. So then it can really cause a certain boundary issue and also cloud your judgment a little bit. So it's always good to just remain objective and to keep all professional work separate from personal.
And I think that's something that comes with experience. So you sort of aren't necessarily, I mean, you can be trained for it, but, you know, and prepared all you want for it. But I think when the time comes, it could probably be difficult.
Yeah, absolutely. Absolutely. Yeah. Okay. Well, you know, at every single stage I used to think, oh, this is the most challenging part. You know, when I had to get accepted into masters, I thought this was the most challenging part. And then I had to do the board exam and I thought this was the most challenging part. And then you start working and you find that there's all these other small challenges that you also go through, you know, whether it's personally or it's professionally, you know, and always maintaining all the ethics as much as possible as you can in your practice. So really, the journey to being a psychologist has its difficulties, but it also has its rewards as well. And it's really about trying to find that balance.
Okay, so it's all challenging. It's all challenging. Yeah, I'm sure it must be.
It is all challenging. Okay, that's the other part of it, where it's just progressively you think this is the most interesting, and then you fall into another part and then it's more interesting. Like when I worked in the psychiatric institution, you know, I first started off with the children and I thought that was just amazing, just how to find the development and to see it as well. But then when I went into the psychotic ward, right, there was a part and the element in the psychosis which I found extremely interesting, especially looking at all the different ways in which psychosis can be interpreted. And then when I went into the more mood and personality ward as well, there was an aspect of that was quite interesting for me. But I must say the work in the neuropsychology ward was really quite interesting, and I must admit it's so broad as well, but it's the most interesting in the sense of you just can never know everything. You're just constantly learning, you know, constantly learning, constantly getting new information, new research is always coming out, new assessments are always coming out. There's a lot of interest in it. So, and it's also relatively new as well, because there isn't a separate neuropsychology category as yet, but it is still quite specialized within the psychology umbrella. Okay, well, with clinical psychology, it is a very strenuous journey, not only with the undergrad and then the honors year and then getting the masters. You have to have the masters in order to be registered as a clinical psychology, and unfortunately you have to write the board exam. Then thereafter you have to do your internship and your community service years, so that's an additional 2 years. So in total you'll be studying for about 7 to 8 years. So it is quite a long journey to become a clinical psychology. But from personal experience, it's been the most rewarding job I've ever had.
Okay.
Yeah. Okay. So that if we can take anything from that, it's a really rewarding job.
Yeah. Okay. Cool. Okay. Thanks, Pholly. Awesome.
Thank you very much for having me.
Cool. That was cool.
Yeah. Oh yeah, to be more technical. Yeah. No, you probably, if you had